Let's talk health now. The University of Boya is partnering with York University in Canada, as well as other institutions in Africa, to use local data, artificial intelligence, and mathematical modeling expertise to manage disease spread with focus on the current COVID-19 pandemic. The research effort aims at developing strategies to predict the spread of COVID-19 and provide modeling that will help national policy makers to manage the virus in real time. And to talk more on this, let's welcome our guest, Dr. Gideon Ngwa Akuma, head of the Mathematical Biology Unit of the Department of Mathematics at the University of Boya. Good afternoon, Doctor.
Good afternoon.
Now, tell us, we know there's a lot of mathematics involved in this project, but in simple terms, tell us, what is the project all about?
Thank you very much for having me on the program. It is it's really good for us to try to let you know that we can contribute towards the fight against infectious diseases using mathematics. Now, the project that we have on the modeling of COVID has 9 objectives, but I can simplify them into 4.
Yeah.
And the first one is to develop mathematical models in order to predict the spread of the infection. And the second one is to use artificial intelligence, computer-assisted learning, to forecast future outbreaks. And the third is to assess the effect of non-pharmaceutical interventions. And I guess you guys do that here without actually thinking about it. At the beginning of the program, I saw the head of state advising people to wear masks and wash their hands regularly. Those are non-pharmaceutical interventions. Our objective is to find out what is the effect of such interventions in the number of cases that come up. If everybody wears a mask, does it work? If you don't wear a mask, what is the consequence? And so we have to use mathematics to predict this kind of...
and that's exactly what people want to understand, mathematics and COVID-19.
Right.
How does that work?
Let's take an example that we are in this room, 4 of us, and one of us is infected. And if I am, the chance of you picking the infection is 25%, 1 on 100. If all of us are protecting ourselves by wearing masks, that chance is reduced to almost 0, because the infection will not jump to the next person. And so we ask ourselves, can we predict if a certain cross-section of the population is applying the government policies, how will that bring down the numbers of infections? And that's where mathematics comes in.
Okay, and this brings me to my next question. How important is this project in actually addressing COVID-19?
Now, we have one of the big points that I did not mention was the creation of a dashboard.
Okay.
A tool which will be available at inspection to see which are the hotspots in the country. Now, the Ministry of Health has a form that they fill when they collect data for this testing, and it tells where you are coming from. If we analyze that data and see that everybody coming from a certain location are testing positive, that will call such a place a hotspot. And we give advice to government that, look, go there, and that is where you can concentrate effort and you would stem the process. We use different techniques, but what we are hoping to use here is artificial intelligence, computer-assisted learning, and which is partnering with our colleagues in South Africa who have developed this process very, very much, and they have used it to advise government in South Africa already.
Okay, and your collaboration with other partners, as you mentioned, what does it entail, and how will it unfold, your collaboration with other partners?
Thank you very much. Our project is funded by the IDRC, the Canadian IDRC, and the Swiss International Development Agency. And it is funded by a consortium. It is funding a consortium that has the headquarters at York University in Canada. And then we have centers across Africa, in Nigeria, in Botswana, Rwanda, South Africa. And the idea is this: if each of these countries come up with this dashboard that we're talking about, and then it is deployed, Africa we can immediately tell at a glance how the pandemic is spreading in Africa. You know, Africa has been spared because we were expecting to see a lot of bodies around, but it seems as if we have certain characteristics which made this disease not very prominent with us.
Okay. And the project will be officially launched on Tuesday, August 17th. Tell us, what are your expectations?
Oh yes, that is really good. With on Tuesday, August 17th, we're expecting to have the Canadian High Commissioner to Cameroon in Buea. We are expecting to have the Ministries of Scientific Research, Health and Higher Education to be present, and we are expecting the local health authorities to be present so that we can give them our vision of how we think that we can use mathematics. Mathematics used to be like scary subject, but nowadays we are demonstrating that with mathematics you can actually do things. We can calculate the number of infections per day. We can calculate how a certain intervention reduces the infections per unit time. We can advise government that, look, concentrate effort on this and that instead of this. And sometimes pharmaceutical interventions like vaccines, which incidentally has a very poor uptake rate in our society, is one of the things that we need to evaluate to see how it's being taken up. And so we are looking forward to having to officially introduce this project to the Cameroonian community on Tuesday, and we hope that they will start taking it seriously. COVID is a very, very serious disease, yes.
And good thing your project doesn't have to do with X and Y's. Thank you very much, Doctor, and wish you all the best on your project.
Thank you very much for having me.
And do stay with us, Martin.